Hmm. Okay, so talking about PTSD, I think one of the significant things that we need to understand in PTSD is the traumatic aspect, which means any incident that an individual gets exposed to, whether directly or indirectly, and that event has a traumatic impact on the individual. And some of these traumatic experiences could be episodes of violence, which could be either physical or sexual. It could also be an accident which has been very bad. It could also be an experience with an earthquake, war, even the fact that you're in a rape cases, and even exposed. So any kind of a traumatic experience that an individual is exposed to, it may happen to that individual directly, or it may it's a vicarious experience for that individual. Floods, disasters, all of this can have and create symptoms of PTSD in people who are exposed to it. Now, trauma is what one needs to understand, because this is what the individual is reliving time and again. So it's not something that you've just had that episode and that episode now is not there, and the individual is fine, only went through trauma during that episode and now is doing okay. PTSD is something where the individual is reliving it on a continuous basis, which means there could be an arousal or hypersensitivity that an individual may experience each time they think about that situation, each time they have memories, recollections of those situations, scenarios, episodes, people, situations, anyone talking about some of these things, and makes them understand or recognize about what they went through. That all of that would cause a free living of that trauma. And we've seen that at least 6% of people who are exposed to an incident can develop PTSD in a much more severe form. For example, a mass disaster or a mass crisis of sorts, it can go up to 30%. And it may also, in much more severe cases, it could be more than 30%, and which could be particularly looking at in war scenarios. Now, if you look at the treatment part, manifestation part, also I would request, if it's possible for all of you to sort of come on video, because it seems like it's just me talking. If it is possible, and
Sure.
if you guys can switch on your videos, that would be helpful. At least it seems like an interaction. And in any case, it's a closed group. So the manifestation, what happens over here is that being exposed to death or anything that makes you feel that you've come closer to a death kind of an experience, threat of the same, even something like I mentioned, drastic experiences of violence, all of these things is how it manifests in the form of trauma. Now, the impact, if one looks at, the impact is on mood, which means your moods can actually go in a varied direction. You may have aggressive reactions and responses to situations that may actually either remind you or trigger that kind of a traumatic experience for you. For an individual outside, it may seem, where did that come from? Because the situation may not be as gruesome, but the response and reaction may be to that extent, because the person who's going through PTSD is reliving that moment. So there is a reaction to it. There could also be alterations in cognitions, which means thought process. If you've had, for example, let's say episodes of sexual violence, physical violence, or you've gone through a very bad, gruesome accident for that matter, you may actually have some of those images, and that thought process may also get altered, which means, how can I trust an individual because I've gone through a violent experience? How can I build my sense of security in a situation like that? Even how is it possible that I may not go through another accident while I cross this particular area or segment for that matter? Again, so it alters your mood, it alters your cognition. It can also lead to a lot of self-blame, because if there are reactions that are happening, so it's altering your thoughts, it's altering your moods. Now, if your thoughts and moods are altered, obviously there's going to be some change in your behavior. And that begins to impact and affect different aspects of your life, which means it may impact your relationships particularly. It may also impact your response to different situations and dealing with challenges in certain situations. Sometimes you may also find it difficult to sort of maintain your workplace performance, or your challenges, deal with challenges at workplace, because something may just, or your response in itself may find it very difficult for you to adjust in an environment like that. So again, the impact is lifelong, and the individual begins to internalize and blame oneself, because obviously not being able to move out of that window of living and looking at world from that traumatic experience certainly brings in a lot of internalization of blame, anger, even towards self. So this is what, in a nutshell, PTSD and going through PTSD would look like. So it's not just a cross-sectional here and now experience. It's something that an individual is living through life. And this is what happens. There's long-lasting impact. You may have dreams, recollections of those incidents, thoughts, images. So there is a continuous arousal that an individual is in. You may also find that the individual may sometimes have some startling response. A certain noise may make them react in a certain way. A trigger may be there, sound, feelings of restlessness, anxiety, to anything that may actually give them that kind of an arousal or trigger. So that is why the person would want to avoid any of the situations that may make them rethink about it. In DSM-5-TR, what they've also added is PTSD in children, which means 6 years and older, between 6 years to 16 years, children who've gone through again similar kind of episodes of violence, of war, of disaster, can also develop symptoms of PTSD. And again, the manifestation would be of similar sort. Just the behavioral signs may be different for children, for them to express in that sense. But even in children, you may find PTSD. The only fact is that if even repeated exposure, so for example, let's say somebody is working in a cell where they are talking time and again with rape, patients with rape experiences or sexual violence experiences or any other form of traumatic experience time and again. Even individuals who are talking to these individuals can also begin to have PTSD. However, when you look at it's not that when you are reading something or when you are exposed to something on TV, in children, that's not when they develop PTSD, and one cannot diagnose PTSD in that sense. So it's not about what they are seeing on TV or what they're watching or what they're hearing. But yes, again, if they are exposed directly or indirectly to a traumatic experience, they can also be diagnosed with PTSD. So now I'm going to let you guys ask questions so that accordingly you can, and I can answer your doubts and your queries around it.
So thank you, ma'am, for that session. If anyone has any questions, you can ask. And yeah, so it's like the place where you can clear your doubts and everything.
If I talk about treatment of PTSD, again, there is biological aspect that certainly comes into play, which means if we are looking at heightened arousal, you're looking at mood changes, you're looking at alterations in thought process, an anxiety response, even mood changes, like I said, it needs to be medically. Then there is evidence-based treatment. Cognitive behavior therapy is one, in which again you work on the thought process that the individual has learned being exposed to these situations, and an association being formed in a certain way. So each time you look at that situation, there is a thought process which is already triggered. And this is how one then begins to think in different situations in a similar way. So one works on the thought process. Similarly, when it comes to how can one reduce the anxiety and the triggered response when they're exposed to situations that remind them of their trauma, is again part of treatment like exposure therapy, behavior therapy would help over there, where again It could be guided imagery. It could be that the patient or the individual is actually taken to the certain similar scenarios, situations, people, and how can one expose them slowly and steadily, help them reduce their heightened response, use a lot of relaxation and breathing techniques that really helps in PTSD. Mindfulness practices really help in PTSD. Guided imagery really helps in PTSD. And there is a lot of evidence in group therapy also. People who've been in similar situations, so whether it's war veterans or people with sexual abuse or physical abuse in group treatment process, are able to feel that sense of oneness with the others who've gone through a similar situation, and that gives them a lot of validation, catharsis, and relief. So group treatment and therapy is also has a lot of evidence in that. And art-based treatment therapies is something that can be used. And at the same time, I think social support is something that needs to be really looked at. Then rather than judging and being, I mean, how can one have an empathetic response to individuals who are going through on a continuous basis in their own lives, in their own minds, through a traumatic experience? How can we sort of extend our empathy in the form of our social support to them is something that really needs to be looked at. So that's in the form of, as a society, what is it that we can do?
If you've raised your hand, please go ahead and ask the question.
I can't hear. Am I audible?
Yeah.
Hi, ma'am. Hi, my name is Vikram. A query: how does one segregate or differentiate between a long-term depression and that to be a symptom of PTSD or something different?
So PTSD is not something, if you are, something happened 15 years ago, 20 years ago, and it's now that you are beginning to have some kind of a recall and remembrance of that situation as now beginning to have a certain impact on you. May or may not be PTSD particularly. What one needs to understand that post-traumatic stress disorder, which means when I talk about alterations in cognitions and mood, there can always be a comorbidity of anxiety and depression in PTSD individuals as well. So when it comes to the treatment part, yes, a psychiatrist is going to also look into that part. When I talk about mood alterations, it could be the fact that there is a persistent sadness that one is experiencing. There could be episodes of depression which is happening. Because depression is also one of the very common illnesses, mental illnesses, where more than 300 million people across the globe actually experience depression. So depression could also be a comorbidity with PTSD that an individual is experiencing. So in a treatment form, one has to just work around the symptoms and what is causing those symptoms in that part. So if a patient with PTSD is coming and is showing some of these signs and symptoms, but yet is also experiencing sadness, a lot of sadness, and in bouts of may also have depressive phases and episodes, then it also needs to be treated accordingly in that sense. And when I talk about comorbidity, which means two mental illnesses can coexist at the same time.
If anyone else has any questions, please feel free to ask.
In general, what depression is where for more than 2 weeks you're having persistent sadness. Sadness is something that you can't snap out of. Again, you have negative thoughts. There can be negative thoughts about self-blame, helplessness, hopelessness towards situations, towards life. There could also be suicidal ideations and severe depression, difficulty in concentration, sleep, feelings of worthlessness, loss of interest in activities and day-to-day activities that one would enjoy earlier, social withdrawal, not wanting to engage even with family or friends, withdrawing from that, not engaging in day-to-day activities, and everything can seem very effortful. That's in a nutshell depression for you. So yes, in a long-term PTSD individual, you may find that they may have episodes of depression too. Yes, Siddhant?
Yes, ma'am. Hi. Ma'am, how common is PTSD nowadays in teenagers?
See, it's more than the teenagers. I would say it's about what you're exposed to. So you would see, I mean, global percentage, one would say that 16% of children and adolescents who are exposed to any traumatic experience may develop signs and symptoms of PTSD. But it's also about what you're exposed to and the kind of gruesome incident that you're exposed to. So like I said, 6% who are exposed to an incident may develop PTSD. In a more severe form of exposure to either episodes of mass destruction, violence, war, rape, it may be 30% or more.
And ma'am, why do people usually tend to ignore their trauma?
That's because one may not be aware of what an individual is going through. Not all of us are aware of what is PTSD. It's the awareness that yes, an incident can have an emotional impact on me, should be a sign enough for one to reach out and ask for help. I think it's not just about for an individual to ignore their trauma, but at large, people who struggle with any form of mental illness, one may not be aware. Even if they recognize that, yes, something is impacting and affecting them, they may deny seeking help. Again, it's a lot to do with the stigma of what people will think, how people will perceive me. Will I be judged? Will it be handled sensitively? Will I be understood? All of those things come in the form of stigma, and actually comes in the way of people asking for help and seeking treatment. So if you need to understand that for larger mental illnesses, people really hesitate to seek help even now, and you would see this more skewed in urban and rural areas in that sense. In fact, in rural areas, sometimes you would see, as long as the individual recognizes there is a problem, they will still go to a doctor sometimes, and then ठीक है इनके पास जाना, इनके पास जाके दवा ले लेते हैं. But the more you come to a certain segment who believe that they can handle things on their own, they don't want to seek any help. So again, it's about how an individual perceives the stigma and their own belief system and stereotype towards mental health and mental health problems and mental illnesses.
Thank you so much.
So Niharika Chauhan has asked this question. I think she's not able to operate her mic. She's asked, although you said that some people are not willing to take self-help options, but she's asking if there are any self-help options for PTSD.
Self-help options? Well, I mean, I would always recommend for an individual to first start therapy, get an understanding, insight, and awareness in terms of what is happening in different situations. Learn the skills, because self-help would also mean not just reading and doing it by one's own self. You can always find books for self-help and do that. So either it's an individual therapy or group treatment, it's important to seek help and treatment for it. So self-help would mean कि हम अपने आप से what is it that I can do, which also requires some awareness that yes, I have this problem or not. So in any case, any individual, the first step that they do is try and manage the problem on their own. It's when they're not able to do it as actually when they go to someone to seek for help. So whether it's a friend, whether it's a family member, whether it's anybody else, or ultimately going to a psychologist or a therapist for that matter, it's after they've gone through, their own experience of trying to resolve their own problem and finding themselves stuck time and again not finding the solution is when they actually reach out for help. So self-help in terms of how can I continue to help myself with the symptoms that I have can happen once you've actually gone through certain kind of a treatment, and now you can use that to help yourself.
Does anyone else have any questions? Ma'am, even I had a question. For one of the answers, you said that very often, two mental illnesses can be correlated in the sense that one can cause the other. I'm just rephrasing what you said.
Not cause the other, but it can coexist. So in a long-term anxiety, you may see the patient also developing signs of depression. Sometimes in a long-term depression, one may see that the patient is developing signs of anxiety as well. So it's comorbidity.
Okay. But is it possible that, for example, some people, they suffer from severe anxiety to the extent that they get anxiety attacks or panic attacks? Can incidents like those result in PTSD?
No.
Okay.
PTSD, particularly the defining factor for PTSD is a traumatic incident or an experience. It is not to do with any form of substance abuse or maybe a medical illness or one mental illness making you feel in this way that you've developed PTSD. Traumatic incident has to be there.
Okay.
Either hearing of a traumatic incident time and again, witnessing it, being exposed to it, that needs to be there. The exposure to a traumatic incident has to be there. But because you're reliving that part, right? So that's why.
But experiencing a panic attack for some people is said to be traumatic. Can that be?
That will be anxiety. No, that will still be anxiety. Yeah. Because in anxiety, again, it's a learned response. So like I said, in PTSD, yes, anxious response and triggers to a traumatic experience is there. So if they've had a traumatic accident, they are going to feel anxious and may have even panic attacks going through that space or place again. But for a individual having panic attack and fearing that I may get panic attack again, it is anxiety, because again, anxiety is more about the association, learned association with a certain situation. So in PTSD, you will see signs of anxiety, but an anxiety cannot cause you PTSD.
Okay.
Ma'am, is there any inference from historic data that a specific type of gender may be more prone to PTSD, or is it truly agnostic?
It's difficult to say that. I think incidence of PTSD is more about the exposure and the impact that it has on the individual than seeing it more in women or more in males for that matter. And it's also because it's the kind of trauma that an individual is experiencing. So if you're talking about war veterans and there are more males that we are looking over there, yet we are talking about sexual violence, which is of course more prevalent in women, we can't differentiate that this PTSD is more in women or more in men. It's more about the exposure.
I guess we'll wrap up in like 5 to 8 minutes because the meeting will get over then. If anyone has any questions, just please do ask till then. I guess if there are no questions, should we end the meeting now?
You may ask me other questions if you want, if not PTSD.
Yeah, that's fine as well. If anyone has any questions related to mental health.
One of the most common illnesses actually is anxiety and depression, more than anything else.
Ma'am, I had a question regarding that. Very often they say that anxiety is depression is mostly a result of anxiety, and that they say that like in most of the cases that is what's happening because anxiety is common in almost every person, but then depression is the result of it.
Mental illness is caused because of basically three things. One is the biology, and you need to understand the biopsychosocial model over here, which means one cause is going to always be a biological cause. Genetics, neurochemical imbalances that are going to trigger certain neurochemical imbalances. And so there is a predisposition to forming a mental illness and developing signs and symptoms. The second aspect is your environment, the social, which means it could be a situation, it could be school, it could be community, it could be family, it could be workplace, it could be consistent long-term relationship issue, it could be grief. This is what forms your environment, your experiences. And the third aspect is how are you what is your temperament and your approach to some of these situations. Now, if you look at it, when we talk about treatment is in two areas. One is the biological part, which is, of course, treated using pharmacological treatment, and which, of course, science has advanced a lot. So when people say and talk about that there is a lot of dependency on medications, that does not happen. So we've progressed a lot in that sense. So there is no dependency on medications. The second part of the treatment comes in scientific-based, either cognitive behavior therapy or any other form of counseling and therapy, because over here the psychologist is working with you on your thought process, on your emotions, helping you develop coping skills so that you're able to better deal with your symptoms, and even your overall quality of life improves. When we talk about the environment is not particularly in an individual's control. So the only part of the social or the environment is how can we continue to develop skills of empathetic response, compassionate response, non-judgmental response in the form of psychological first aid, because this is where the community comes in. So as a friend or a peer, how do you respond to another friend who's having mental illness, reaching out to you, talking to you about this? Your response is going to provide and give them that supportive experience. So this is the role of the social or the environment over here. Similarly, how a teacher responds, similarly, how a co-worker or a boss responds, or a family member's response is where then the external role is. But the person who's going through some mental illness may not have a lot many times the external in their control. They may be able to change it, they may not be able to change it. So when it comes to treatment, it's mostly about the individual, working with the individual. Wherever the family is open to it, working with the family. Otherwise, pharmacological treatment and therapy with the individual.
Okay, thank you so much, ma'am. I guess we'll end the session here. So thank you so much for being here. Thank you so much for answering the questions and for the seminar. And yeah, let's end the meeting.
Okay, thank you.